Hi, today I'm going to discuss with you on this treatment of COVID-19. And I know this is a virus caused Wuhan pneumonia. Before we go into talk details on the treatment, we again come back to have a look at these cases. And as of today, February 17, so the total cases of coronavirus infection reached 71,451, and the deaths reached 1,776. And it may be easy for us to again look at this on the graph. And looks like the cases, the cumulative cases, continue to increase, and also death. People also continue to increase, and we wish that number will going to drop in 1 or 2 weeks. And another important the criteria we look at is cases, especially new cases of the virus infection. And here's the total cases, new cases, and looks like that cases continue to increase, and also the actually right now the daily cases is almost no change, and so the new case is very important for us to monitor these diseases. We hope that this is very important in terms of epidemiology aspect of disease until we have no new cases to indicate the virus may be died down gradually. Okay, now let's talk about this the treatment of these diseases. And so again, when we talk about treatment of the virus infection, that means we need to kill the virus. So in order to kill the virus, we need to know this life cycle of the virus. That just look how the virus get into the body, and then how the replicate in the body. And so without understand this, then we then can have approach to kill the virus. And here's the life cycle of COVID-19. I should point out this is the we don't know this true life cycle of COVID-19. Here just give you normal coronavirus as example, but I guess the basic principle for virus life cycle should be the same. Even so, you may find some small details may be different from this case. And here's the virus. So when this virus gets our upper respiratory tract, and first of all, they need to attach to our normal cells. So this virus attached to our cells through this spike protein, this spike, and the spike binds to this receptor on human cells. And if the binding is strong, and the virus then have potential to get into the human cells. As soon as the virus gets into the cells, then they start this life process. And first of all, it needs to release its genome into the cells. And the genome is like head of this entire virus particle. It contains information for the virus to generate translation, generate different proteins. And these proteins would assembling to replicate, so the iron genome can be replicated. And during this process, this genome can be transcribed into many different messenger RNA, which then use as template to create many different proteins. And the protein includes structured protein and non-structured protein. And all these are building material and for them to assemble a new virus. So when this is ready, the structured protein is ready, and also genome was replicated. So all this material will be assembled together, form a new virus. And gradually this virus goes through this exocytosis process, and so then released to outside of human cells. But in the human, that means this virus then can go into infect new cells and then start a new life cycle. This cycle is known if you don't take a measure, and this cycle is likely to never end. They're going to until they kill people if people don't take measures to stop this process. And of course, right now we don't have any established treatment. And here, just based on this, based on our previous studies on other viruses, include coronavirus, SARS coronavirus, and MERS coronavirus. And some of this, all this have reagent have tested on against this virus infection. And I should focus on this, maybe just focus on this one, remdesivir. And this is a reagent which actually on the stage of RNA replication. So this remdesivir is direct impact on this genome replication process. So this drug will stop the virus genomic to replicate it. So in this case, then the genome cannot, they don't have genome, then cannot assemble any virus. So that reached the goal for the treatment of this virus infection. And then, of course, one of the most things, because in terms fight against this virus infection, the two parts, virus and human body. And the human body needs to have all this mobilized system to build up arsenal against the virus. And it's well established if you can enhance your immune system, use interferon and such as chlorine. This kind of immune regulatory agent to enhance the immunity. Then you have a chance to build up your system against the virus. So anyway, for treatment of the virus, this kind of balance between the virus and the human body. The best thing is that the human body becomes strong and can easily hit this virus. And then virus, if human body become weak, the virus gets strong and strong, and then be occupied all your machinery of human body and cause a series of consequences. And I should point out another thing, that is plasma, and several reports indicate that you can get plasma from a patient who is recovered from this COVID-19 infection. So such plasma have not only antibody, but they have a large of active agents which have potential to kill the virus. This may be also another good approach. So now let's just have a look at some real case how this virus was treated. And so we know exactly, maybe help us to understand better. Maybe also help you to understand, just in case you need to make your own decision. And because doctor just can give you suggestion, and they need you personally approve what kind of treatment you would like to have. And here just show you example of the first case of 2019 novel coronavirus in the United States. And here, this is a nice paper which shows the entire process and how this patient was admitted to the hospital, and the detailed treatment process. And here it's just, of course, when the patient comes, because we have no idea caused by what kind of infectious agent, what kind of cause. So, and can only way to detect is uses a supportive circuit. So, like have fever, then you just try to reduce your fever, and the cough, you use anti-cough agent. Anyhow, during the process of the treatment, and this patient actually was given some treatment, remdesivir, and that's his description of the treatment with intravenous remdesivir, a novel nucleotide annual prodrug in development, was initiated on evening of day 7. And why to use this antiviral drug? Because they try all different kinds of treatment, include antibacterial and other antiviral agent, but it's not effective. So on day 9, day 7, they actually used intravenous remdesivir. That means they just inject this drug into your blood. So this is the quickest way for you to reach the target, maybe lung or even upper respiratory or lower respiratory. This is, and the reason that after treatment on day 8, and the patient's clinical condition improved. That's just amazing. So in this case, I kind of suspect, I'm not sure this is really the outcome of remdesivir treatment. And because only use 1 day can not imagine that the drug can have such effect in such short time. Just 1 day to get such effect. But never know, maybe this is a real case. And right now there are more than 40 different kinds of compound agent was used in the clinical trial for treatment of COVID-19. And of course, this remdesivir is one of the most, I think it's number 1, because we already have experience, and that antiviral drug is already used in many different virus infections, include SARS and Middle East respiratory syndrome. So that can be most effective antigen. But we need going to see, because this clinical trial is going on, we are going to see the data very in pretty short time. As mentioned that treatment for this disease is use patient plasma, and that means plasma from patient recovered from this virus infection. But there's no scientific report. Just show the recovered patient donate blood for COVID-19 treatment. And here just have a brief description on, seems very, very, so that many patients agree to donate blood for COVID-19 treatment, and pretty large amount, 300 milliliters for medical use. So in February 8th, 9 critical patients at hospital received blood transfusion. Results show that in 12 to 24 hours later, the patient's condition in the oxygen in the blood has risen and the inflammation dropped. All the symptoms are all improved. And that I think this may be right now the plasma from patients who suffer from COVID-19 may be the best way to treat critical patients, because for the critical patient we really need to kill the virus immediately, and so they can recover, and that's may be the best approach. Anyway, that even so, we don't have treatment for this virus infection, but you can see that we have extensive list potential agent for treatment this virus. I think that in the end we are able to find one which have very effective to against this virus infection. And so far there are many clinical trials is in the process. I'm sure that will be very quickly get results, and there will be provide effect control to control this virus infection. And that's it for today. And thank you for watching my video. I'm going to see you on my next video. Bye.